Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 825th 825वां एपिसोड है. Let's have the headlines for today. A research study has shown that controlling the aerosolization of mucus prevents poor outcomes from COVID-19. तो अभी भी रिसर्च चल रही है and we can actually prevent the severity of COVID-19. Do be aware कि अभी भी COVID-19 है भारत में, इंडिया में. We still have patients who come in COVID positive. And study has revealed that some parents, many parents actually, may needlessly give kids fever-reducing medicine. So don't rush to take antibiotics unless your doctor has actually prescribed them. India has donated 20 kidney dialysis machines to Nepal, so that's a small step forward for better health in South Asia. And on the other hand, while speaking of fasting, a study has suggested that patients with fatty liver may benefit from alternate day fasting. The company Zydus Life Sciences has received tentative approval from the US FDA for gabapentin tablets. These are indicated for the management of post-herpetic neuralgia. And yet another study has shown that using vitamin D regularly can help prevent the occurrence of type 2 diabetes. It can reduce the risk of type 2 diabetes in people who are at risk of it. With this, let's go to our topic for today, a very important topic, and this will be the first in a series of 4 discussions on this topic. Let's see what our topic is for today. Now, is it a vitamin? Is it a hormone? Is it a panacea for everything? ये चीज क्या है? Let's find out. Let's get a clinical update from our expert, Professor of Endocrinology and Medicine. Warm welcome, Professor Nitin Kapoor.
Thank you so much, sir. It's always great to be back at KK Med Talk.
And thank you, Professor Kapoor, for being with us, being our travel companion, our humsafar in this journey towards better health. Dr. Kapoor is a frequent speaker on KK Med Talks. He's a consultant in endocrinology, a professor in the medicine in the endocrinology, diabetes, and metabolism department at the prestigious Christian Medical College, Vellore. He has done his PhD from Australia, and he is also a faculty at the Baker Institute in Melbourne, Australia. And you name it, that means you name the gold medal, and he has it, whether it's from India, from Sri Lanka, or from elsewhere. He has won virtually every gold medal there was to win in his career as a student and as a junior faculty. More than 200 peer-reviewed publications, and he is now considered a global expert in the field of barocrinology. He is also the editor of my favorite textbook on diabetes, which is a practical guide to diabetes mellitus. But Dr. Nitin, warm welcome. Now, this D, you are described in many Ds. You are described as being determined, as being dynamic, as being dashing. What is vitamin D?
So, thank you so much, sir. It's always a great privilege to share the stage with you, and especially talking today about vitamin D, which I would say has the maximum dilemmas associated with it. And there are so many myths as well as there are so many misconceptions. And despite so much literature emerging about this vitamin D, or if I may say, a hormone, as it should be called, I would say that, I think there's a lot more to know about it. There is more clarity needed about it in our day-to-day clinical practice, and we hope that this session would help some of us to clear that.
We have people logged in from across the country. हमारे जो health योद्धास हैं, our health warriors, स्वप्ना जैन मैडम from Vellore, पूनम बजाज मैडम from New Delhi, अरुणा त्यागी जी हैं, अवध किशोर राठौर साहब, डॉक्टर अंशु सिंह जी, रत्नेश जैन जी, डॉक्टर प्रदीप रावल, and then we have doctors from general medicine, general practice, gynae, internal medicine, endocrinology from all over the country. So would you like to share some slides and talk to us about the Ds, the dynamicity of vitamin D?
Yes, sir. So I would just share my screen and we'll take you through very briefly our topic for today. Mhm. Right. So I hope my slides are visible.
Not yet. It's like vitamin D, and now they come. So if you take one dose of vitamin D, Dr. Nitin, does it act immediately? Or is it a lifelong kind of a thing? If it's a nutritional deficiency, like let's say you have to drink water every day, perhaps we can address that as well sometime during this 7-day talk.
Absolutely. And maybe the third D would probably answer that. And I must write at the onset acknowledge that this 7D, the power of the word D in vitamin D, is what we're going to present to you today, the 7D. But before we go forward, I think I need to acknowledge and fully give the credit for the brain behind these 7Ds. That is none other than our Dr. Sanjay Kalra, and along with the team of IJCP, including our colleague Dr. Pooja Banerjee, who's really helped us to devise this in the last few weeks that we've been working on it. And in this very short presentation, I will take you through these 7 Ds of vitamin D, and we would break in between for questions. But please keep sending in any doubts or questions that you may have. So the 7D framework starts with the first D of demand. Ki how much is the demand of vitamin D? And I'm going to talk about कि कितना vitamin D deficiency है इंडिया में. But I'll also share a small study जो हमने वेलोर में किया था कि as a hospital, as a big medical college in India, हम लोग कितना vitamin D टेस्ट करते हैं एक साल में और क्या उसमें हमारे रिजल्ट्स रहे. I will share that very briefly. That is the first D जिसमें हम डिमांड के बारे में बात करेंगे. The second D is kitna dose हमको लेना चाहिए. That's the dosage. The third D, and I think the most important D, and that's what probably Dr. Sanjay Kalra also alluded to before starting, duration. And I think if, as a physician, what I have learned in a hard way, and what I would say, that's something that we need to do. For many of our patients, we do start treatment emphatically, but we forget to emphasize on the need for its continuous therapy, and what duration of therapy would be our third D. And maybe after the third D, we'll take a small break and take a few questions that are coming in. Then we'll talk about fourth D, dynamics. क्या हम सब एक जैसे हैं? क्या हम सबको उतना ही vitamin D चाहिए जितना हमारे colleague को चाहिए? Are we different, or are there any special situations in our clinical practice where we need to focus that this person may need more vitamin D? That's about the dynamics of vitamin D. We'll talk about the different preparations, and again, a very interesting study from All India Institute of Medical Sciences that I'll present in that fifth D of delivery. The sixth D is desirability. What should be our targets? And the last, what is the message that I like to leave you, not only as physicians, but even our general public who is joined today for us. So, what is the future direction? So, without wasting much time, I think I start with the first D, and that is talking about the demand. Now, despite our knowledge, and I think this is taught in small classes, even in school, that we get vitamin D from sunlight. And I think there's no better country than India to have so much sunlight across that we have, especially in summers. Rather, in a place like Vellore, if somebody asks me which weather is good to come, I would say there are just three weathers here: hot, hotter, and hottest. And there's so much abundant sunlight over here. But despite that, and as Dr. Kalra calls it, as a heliophobic country, जिसमें helio मतलब sun, तो हम we have so much sunlight, but probably most of us are almost indoors most of the day. And the kind of prevalence that we've got in studies from Vellore and across India, matlab, almost I would say three-fourth of the Indian population used to be vitamin D deficient maybe 5 to 10 years ago. अब थोड़ी सी knowledge बढ़ रही है. So now in the more recent studies in the last 2 to 3 years, the prevalence of vitamin D deficiency थोड़ी कम हो रही है, but still I would say it's a big problem. It's in pandemic proportions. Very nicely, WHO has listed this in the WHO model list of medicines in 2021, as well as the national list of essential medicines. But talking about the D as demand, kitna demand hai, and sharing our own experience from a medical college here in Vellore, कि हमने सोचा कि देखें कि एक साल में हम लोग कितना vitamin D टेस्ट करते हैं पूरे हॉस्पिटल में. And the number was absolutely startling. We did 95,000 plus tests in 1 year in CMC Vellore. So, yes, it's a big volume hospital, but 95,000 tests for a test, which is a little expensive, I thought is too much. And we could get a lot of information. And from a hospital based setting, also, we find that काफी लोगों में, अराउंड 40% लोगों में विटामिन डी डेफिशिएंसी रही जिनका टेस्ट हुआ. Got a very interesting paper published in Journal of Postgraduate Medicine for those who are interested. कौन से region में कितना vitamin D deficiency? We get patients from all over the country, northeast and even outside India. तो किन किन जगहों से ज्यादा vitamin D deficiency था, and कितनी demand रहती है इस test की, is what is really emphasized in this first D that I spoke about. Well, the second D, कितनी डोजेज हमको देनी चाहिए विटामिन डी की. एंड आई थिंक इट्स इंपॉर्टेंट टू नो कि अगर हम एकदम नॉर्मल हैं, एकदम एसिम्टोमेटिक हैं, तब भी हमको विटामिन डी चाहिए, बिकॉज दैट्स लाइक फॉर एनी विटामिन, बी इट ए बी सी डी ई और के, जोन सा भी विटामिन हम यूज करें, हमारी एक स्पेसिफिक नीड होती है, एक रिकमेंडेड डेली अलाउंस होती है जो सेट की जाती है नेशनल स्टैंडर्ड्स के हिसाब से. And on an average, if I would say we would require anywhere between 800 to 2,000 units per day. And the common preparation which is available in India is about 60,000 units. So I would say maybe one such preparation of 60,000 is required every month for almost every normal individual. But when we get symptomatic about vitamin D, and then if it is insufficient or if it is deficient, then our requirements are much more, and that's why we need to give a little higher dose in these individuals to begin with. So that is our second D. What is the dose? But for common and general population, we must remember that we have to consume about 1,000 units of calcium, vitamin D every day. And believe me, for getting that from sunlight is not easy, especially in very hot climates. We may actually get quite dehydrated if you just depend on sunlight. So sometimes it's really important to depend on fortified foods or medicinal preparations of vitamin D to get that dosage of vitamin D. So that was the second D that I'm talking about. And I again stress the third D that we have, the third D of duration, is very, very important. We start vitamin D for everyone, as I said before in the previous slide, 800 to 2,000 and up to 6,000 units for symptomatic people. But the important thing is that we have to remember the maintenance. एक बार शुरू कर दिया, उसके बाद मेंटेनेंस डोज पे जाना जरूरी है, एंड वी हैव टू मेक श्योर दैट दिस विटामिन डी इज कंटिन्यूड लॉन्ग टर्म. So friends, so far we just covered the first 3 days. Demand, कितना vitamin D check होता है, कितना deficiency है. A large proportion of our population is deficient. How much is the dosage that we need to take? And again, I've told for normal Indian individuals, on an average, adult would require about 800 to 2,000 units per day. And duration, yes, we need to continue it long term. इसमें ये नहीं है कि कोर्स हो गया 6 हफ्ते का, 8 हफ्ते का, एंड फिर भूल जाएंगे, एंड फिर 1 साल के बाद चेक करेंगे, अगेन वी रियलाइज वी आर एट रॉक बॉटम लेवल्स. So we need to give that maintenance dose long term. So friends, before we go ahead with the 4, 5, and 6, 7 Ds that we have to talk about, let's take a break and talk about some questions that are coming in. Over to Dr. Kalra.
Thank you, Dr. Nitin. Lots and lots of questions coming up, and lots of appreciation also for your talk. You've begun on a very dynamic note. And this message from Uttar Pradesh says that Dr. Saab bade dhinchuk hai, a dhinchuk dude. So I think that would be the first time you would have gotten a moniker like that, and certainly not in CMC Vellore. But Vinny Joglekar ji, madam is a nutritionist in Bangalore, and she says, sir, you've spoken about dosage and duration. What happens if a person misses a weekly dose? Then do we just give that dose anytime we remember after a few days, or should we restart the entire 3 months dose all over again?
No, I wouldn't say that we need to restart all over again. We do give it as soon as we remember. But yes, we try and minimize our forgetfulness. We don't forget some very basic and simple things which may not be important, but when it comes to health, I think we should prioritize. But yes, if we've forgotten, we should restart it immediately, not from the first dose.
And greetings to you from Dr. Nahida Tarannum and also Kedar Joshi ji. Vinny ji पूछती हैं that can we give vitamin D dose before alcohol, after alcohol? Does that make a difference? And can we have it over the weekend? Because sometimes food patterns change, meal patterns change during the weekend.
Right. So I think more than alcohol, what is important to remember that some of these preparations are, to be dissolved in a fat-rich substance. So vitamin D, from our knowledge in physiology, what we've learned is a fat-soluble vitamin. अब सारे vitamins में चार vitamins A, D, E और K जो है वो फैट soluble vitamins है, तो उसको दूध में मिला के पिया जा सकता है, दही में मिला के पिया जा सकता है. Some of these granules that are available have to be mixed in milk, not particularly related to in relation with alcohol, but definitely if you don't like milk or fat rich substances, there are preparations that we'll talk about in the fifth day of delivery कि उसको कैसे ले सकते हैं, but not really a problem taking it before or after alcohol. Weekends is definitely fine. Most of my patients I do recommend Sunday के Sunday, जैसे ads आते थे पहले for Medicare कि Sunday के Sunday, you do. It's just the idea is simplicity and you remember to do it.
Sometimes when our patients are on maintenance therapy, maybe once in 14 days, then we tell them Amavas and Puranmashi, that is full moon day and zero moon day. And then we tell them it's a nice way of remembering the lunar calendar, whether it's the Arabic calendar or the Indian Hindu calendar. And then people are very happy to do that as well. Many important questions coming up. Dr. Deepak has asked a question. Perhaps we can take that up in desirability. Dr. Deepak says the target value of vitamin D in pregnancy and recommendations. So we can take that later. And then Dr. Shobna says polycystic ovary syndrome and vitamin D. Would you like to take that now or later, Dr. Nitin?
Sure, we can talk about it now, but the main reason where we would like to keep it is dynamicity. कि कौन से patients में ज़्यादा हमें careful रहना है. तो when we talk of obesity in general, तो हमें जितना भी हमारे पास vitamin D होता है, when we have more fat in our body, our vitamin D tends to get distributed in the fat. And I think PCOD, the main pathogenesis is insulin resistance, and there is more of visceral fat and ectopic fat. So maybe it is important to correct and rectify vitamin D. I'll talk more about it in dynamicity, but yes, it is important to rectify vitamin D in them as well.
And also important questions coming from Dr. Syed Nishat. Again, we can take them up later. Optimal dose, target, desirability for postmenopausal women with diabetes, for senior men, senior citizens with hypertension, with heart attack, history of heart attack. So we can talk about that later. And then there is this question which I think you should take up in delivery, Dr. Nitin. Again from Dr. Nahida. She says that in Hyderabad, at eye screening camps, people are giving a combination of vitamin D and vitamin A. So what's your opinion on that? And how are vitamin A and D linked to each other? All these questions are coming up. Let's wait for Dr. Nitin to complete his talk from dynamics to direction, and most of these will be answered. And जो question है सरताज सिंह जी के और अंशु सिंह जी के, what are the symptoms of vitamin D deficiency and how can we help ourselves through diet and exercise, that we can take up later. So we'll go on with D for dynamics. But while
Sure.
speaking about dynamics, Dr. Nitin, what are the common symptoms, what are the common signs of vitamin D deficiency? तो ऐसी कौन सी तकलीफ है जिसके साथ मरीज आपको प्रेजेंट करता है और ऐसी कौन सी चीजें हैं जो आप खुद देखते हैं मरीज में? So can we do that first before we move ahead? Symptoms
Sure.
and signs of vitamin D deficiency.
Right. Right. So thank you, sir. And I think that is an important aspect to be discussed, talking from the symptomatology perspective. And I must say that vitamin D deficiency has a huge spectrum of presentation, right? From very severe disease, जिसको हम बच्चों में बोलते हैं rickets या बड़ों में osteomalacia, जिसमें kind of the bony pains, the deformities that we get to see are really crippling and very very disheartening and can really make the patient's life miserable. Though what we used to see say 15 years ago or 20 years ago, we see less and less of those severe cases because of the awareness of vitamin D that we have today, but it is still not uncommon. And I would still remember कि last 1 year I still have seen patients with severe osteomalacia जो होते हैं. तो अब उनके क्या प्रॉब्लम्स होते हैं, क्या सिम्टम्स होते हैं? सो टॉकिंग अबाउट द सिवियर फिनोटाइप, उसमें बहुत ज्यादा पेन हो सकती है, हड्डी में पेन. इट कुड रिजल्ट इन डिफॉर्मिटीज, जिसमें हम कॉमनली बोलेंगे बोइंग ऑफ लेग्स हो सकती है, या जो हमारे हाथ के या वेट बियरिंग जो हमारी हड्डियां हैं, दे स्टार्ट पेनिंग क्वाइट अ लॉट. Vitamin D is also very important for muscle metabolism and proximal myopathy, जिसको हम बोलते हैं कि weakness of the core muscles of our body. That could also happen. So common symptoms क्या, patients proximal myopathy में बोलेंगे डॉक्टर साहब जब हम जमीन पे बैठते हैं खड़े होने में बहुत तकलीफ होती है, या जब सीढ़ियां चढ़ रहे हैं, then it could lead to a problem and difficulty in climbing. या upper hands के जो symptoms होते हैं proximal myopathy, patients would say डॉक्टर जब कंघी करते हैं, कोम करना है, देन वी फाइंड कि हमें बहुत ज्यादा मुश्किल होती है, वीकनेस लगती है हाथ में और नहीं कर पाते. सो यस, इट कुड लीड टू अ वेरी सिवियर फिनोटाइप इन अडल्ट्स इन ऑस्ट्रोमलेशिया. बच्चों में अपार्ट फ्रॉम दीज सिम्टम्स द बिगर प्रॉब्लम इज द ग्रोथ रिटार्डेशन. उनकी हाइट छोटी रह जाती है एंड दे टेंड टू हैव a short stature. जिसमें that is another severe problem. So that is about talking about vitamin D deficiency as a severe phenotype. But as I said, vitamin D deficiency is rampant, affecting about 3 out of 4 of every Indian, approximately. So that is a huge problem, and it could have an opposite spectrum. इतना ज़्यादा symptomatic disease भी हो सकता है, but at the same time, despite having low vitamin D levels, we may just have aches and pains. We may just feel miserable, but actually, when we improve the vitamin D level, that's when our patient would realize कि वो मैं इतनी पेन में था और अब I'm feeling so much fitter. I'll quote one of my patients who actually came and tell me, डॉक्टर साहब आपने ऐसी दवाई दी, मुझे ऐसा लग रहा है कि आपने ड्यूरासेल की बैटरी लगा दी है. I feel so much more energetic and enthusiastic. The point that I'm saying is that symptomatic vitamin D deficiency could be very variable. एंड अब आप पूछे क्यों इतना वेरिएबल है, दो लोगों का सिमिलर विटामिन डी लेवल इतना कम है, दैट there's several reasons to it, because the vitamin D that we commonly measure, or the vitamin D that we commonly consume, is not the active vitamin D. ये जो vitamin D है ये convert होता है active vitamin D में. हमारे body में kidney is very important for कुछ और hormones हैं which are very important, like parathormone, जो इसको convert करते हैं active vitamin D में, and that is the vitamin which really helps in our calcium absorption, metabolism, and improving our bone health. Now, there are several reasons why this dynamicity may be different, and therefore the symptomatology may be different. But cutting a long story short, I think it's important to screen for vitamin D deficiency in any patient who presents to your clinic with metabolic bone disease, be it as simple as osteoporosis or as severe as osteomalacia in terms of vitamin D deficiency. Now, talking about the signs of vitamin D, and I think I've covered some of them. Again, proximal myopathy is important. In children, when we talk of rickets, there's several signs which are important, right from widening of wrists to even, what we say is skull. Itna mulayam ho jata hai ki when you press it, you may actually put a dent on the skull. It could lead to that kind of severity. Obviously, bowing of legs in children, especially when they start walking and putting weight on that, maybe at the age of 1 or 2 years, is another important sign of vitamin D deficiency. And yes, if later on we go on to biochemical investigations, we need to measure कि मतलब हाँ calcium level कैसे है, kidney का function कैसे है, and parathormone level कैसे है. आजकल more and more literature is talking about कि vitamin D deficiency is there, but उसकी वजह से कितना parathormone hormone level ज़्यादा है, that is more important than just vitamin D deficiency. But anyways, I think cutting a long story short, the message that I'm leaving you with is that it is very, very variable.
The questions continue to come on this. How do we diagnose vitamin D deficiency? Let me just repeat डॉक्टर साहब ने क्या कहा. जो symptoms हैं, in simple words, either bone pains or muscle. मरीज को पूछें कि जब आप गुरुद्वारा साहिब में मत्था टेकते हैं, when you go to the गुरुद्वारा साहिब to pay obeisance, do you find it difficult to bow down and then to get up? जब आप नमाज पढ़ते हैं, तरावी पढ़ते हैं, तो तब आपको मुश्किल आती है क्या? And then suddenly the patient will say, yes, when I read the namaz, I want to speak with Allah, but actually I end up speaking with my knees. My knees keep on troubling me. So, and nobody ever asked me this question. So, अब देखो जो diversity है of vitamin D deficiency. एक तो ये है between symptomatic and asymptomatic. Some people have the symptoms, muscle pains. Others have the symptoms, bone pains. Others have both. But on the other hand, there will be people who have no symptoms, or they think that they do not have any symptoms. Supposing I have a pain in my muscles while climbing stairs. So whom will I speak with? I will speak with someone of my age. So let us say I am a 60-year-old lady. I find it difficult to climb up till the third floor. I will speak with my sister, my sister-in-law, my best friend, and she will say, "Arey, you have problem in climbing up till third floor. I have problem in climbing up till second floor also." So you are ending up normalizing a medical condition. It's only when the doctor asks you that you realize, yes, this can be a symptom. That is why half of our heart failure is not diagnosed in India, because the symptom is easy fatigability. But everybody else is fatigued around you, so you think that anemia is normal, heart failure is normal. एक तरफ तो ये है, and दूसरा, sometimes it can be more severe, not just the bone pains or the bone pains or the muscle weakness. It can also be bowing of legs, knock knees, short stature in children, and these are some of the questions that are coming up. So a wide spectrum of disease, but do ask your patients. And अगर simple दो सवाल पूछेंगे, जब हड्डी को दबाते हैं तब दर्द तो नहीं होती. So when you press the lower part of the tibia, does it hurt? When you press the lower part of the ribs, does it hurt? It can be a microfracture, it can be vitamin D deficiency. Microfracture means you will not see it on a normal X-ray, but actually the fractures are there, the fracture lines are there. And second is, जब आप पैदल चलते हैं, 2 मील चलने में ज्यादा दिक्कत नहीं आती, मगर अगर आपको 2 मंजिल ऊपर चढ़ना पड़े या नीचे उतरना पड़े, when your proximal muscles are being used, तब आपको दिक्कत आती है. A simpler way would be, when you go to the temple or Gurdwara Sahib or mosque, do you find it difficult to pay obeisance? That will also help. And the third is, maybe you have to lift 20 kg of weight. You are able to do that. But if you have to pick up even 5 kg and put it, on a high shelf where your shoulder muscles, proximal muscles are being used, then you'll get in trouble. So these are vitamin D deficiency symptoms. And if we begin asking, we'll find that lots and lots of people have it. And जैसे डॉक्टर नितिन ने कहा कि उनके मरीज में ड्यूरासेल की बैटरी लग गई, हमारे मरीज भी कहते हैं. सो ऑफ कोर्स आवर पेशेंट्स हियर इन हरियाणा आर अ बिट नॉट हियर, सो दे विल से किक आ गई, ताकत आ गई, जादू आ गया, जवानी आ गई. एंड actually it's a very happy feeling, because with such a simple therapy you are able to help your patients. Of course, do remember the dosage and the duration, like Dr. Nitin has said. It has to continue lifelong, though in a lower dose. So Dr. Nitin, we'll continue with the 4 other Ds. And I guess they'll all be more dynamic and more dhinchuk than before.
Sure, sir. So I think let's continue with the fourth D and dynamics. Just the main question that we are trying to answer, किस एज में, स्टेज ऑफ लाइफ में, किस वेदर में हमें विटामिन डी ज़्यादा केयरफुली असेस करना चाहिए एज डॉक्टर्स, एज पेशेंट्स, हमें कब इसके बारे में अपने डॉक्टर से पूछना चाहिए. एंड ओवरऑल इट इज समथिंग दैट इज डिपेंडेंट ऑन अ लॉट ऑफ थिंग्स. नाउ ऑब्वियसली as compared to summers, winter season में sunlight कम होती है. We've realized that sunlight is something which is very important, जो हमारे skin में ये vitamin D बनने का पूरा process उसकी वजह से start होता है. And so obviously there is more vitamin D deficiency in winters rather than some Western countries. The dosage that is given of vitamin D in winters is actually double than what is given in summer. So season is important. Age is important, because as we grow older, our bones tend to become more weaker. Our muscles become much weaker. We talk in terms of osteoporosis and sarcopenia that develops as we grow more older. And obviously, therefore, it is more important to empower our bones and muscles with vitamin D as we are more elderly. I think I did speak about body weight, and it's important to treat vitamin D deficiency in people with severe obesity, because not only, as I mentioned, कि फैट ज्यादा है, तो जो विटामिन डी हम लेते हैं और ये फैट सॉल्युबल विटामिन है बहुत ज्यादा डिस्ट्रीब्यूट हो जाता है, हड्डी के पास ज्यादा पहुंचता नहीं है. बट ऑल्सो इम्पोर्टेंट, and a lot of research more recently has shown that अगर आप बहुत ज्यादा सिवियरली ओबीस है, वेट 100 किलो से ज्यादा है, तो our bones are taking a lot of load. उसकी वजह से मजबूती तो थोड़ी मिलती है बोन्स को, बट अगर कोई फ्रैक्चर हो जाए उसकी हीलिंग बहुत मुश्किल हो जाती है. एंड इट्स वेरी इंपॉर्टेंट that vitamin D is given in adequate doses even in people who have a higher body weight. Well, from a physician point of view, it is important to refer a patient for vitamin D supplementation when they have GI disorders. तो malabsorption होती है, तो जितना vitamin D मिलना चाहिए नहीं मिल रहा है. अगर ज्यादा इंप्रूवमेंट नहीं हो रही है, साथ में लिवर एंड किडनी की प्रॉब्लम है ना, एज आई सेड बिफोर, जो हम विटामिन डी लेते हैं, दिस हैज टू गेट एक्टिवेटेड इन द बॉडी. द फर्स्ट स्टेप इन द लिवर एंड द सेकंड स्टेप इन द किडनी. एंड इफ आवर लिवर एंड किडनी इज नॉट वर्किंग राइट, probably your doctor needs to give you something else, which may be an active vitamin D, which obviously is not the talk of today and it's not supposed to be taken routinely, but in special cases it may be required. And obviously, in people who've had bariatric surgery, unka jo pura GI system hai, that is now in a altered state, and there again you may need to take vitamin D, not only vitamin D but many other vitamins which need to be continued again long term. So we're talking of dynamicity of vitamin D, and in this we are talking about in which are the special situations that we really need to make sure we treat it. Moving on to the fifth D, and this is the D of delivery. And when we look at the Indian market, ki kya kya vitamin D ke supplements, kis formulations may available hai. So today we have granules, tablets, capsules, syrups, gels, you name it and have it. And I think the simple answer, kya delivery important hai, is दैट हमारे पेशेंट के लिए क्या अच्छा है. जब मैं कोई पाउडर दूं, जैसे मैं बोल रहा था कि दूध में डाल के पीना जरूरी है, देन इन दैट केस इफ माय पेशेंट डजंट लाइक मिल्क, डजंट ड्रिंक मिल्क, so I cannot say इसके लिए जबरदस्ती पीना. If my patient has a lactose intolerance, that patient would not take the vitamin D because of the fear of getting diarrhea and will probably skip doses. Then probably I need to use a solution. If my patient is not increasing or is not very compliant with vitamin D or has that kind of an issue, so maybe I need to give an injection. Sometimes patients don't like capsules. So in that case, again, syrup may be better. Or the other way around, some patients just hate syrups. They say, Doctor, goli de do, wo kha lenge, but syrup nahi piyenge. Then I have to give it as a capsule. So, well, it depends on what kind of the patient you have and unki kya preference hai. But just one word of caution: we have several vitamin D preparations in the market, and I think we have to make sure that we are using good quality medicine. And this is a paper which was published from the All India Institute of Medical Sciences, looking at different 10 plus brands of vitamin D which are available in India, जिसके ऊपर लिखा हुआ है कि इसमें 60,000 units है, पर actually उसमें कितना है वो as low as 2000 से लेके 1 लाख तक निकला जब उन्होंने चेक किया. So I think it is important that you go to your doctor and take a standard vitamin D which your doctor will prescribe, rather than just taking any vitamin D off the shelf that you may think is good. The next D, which is the 6D, is desirability. What should be our target? And इस पे काफी questions आ रहे थे. I think this is a very nice guideline which was published by both the Endocrine Society and the Indian Society of Bone Mineral Research. जिसमें बहुत clearly सारे vitamin D levels जो हमारे targets हैं वो लिखे थे. And it's mentioned कि general population में at least 20 nanogram per ml हमारा level होना चाहिए. अगर पेशेंट को ऑस्टियोपोरोसिस है या हाई रिस्क फॉर ऑस्टियोपोरोसिस तो 30 नैनोग्राम पर एमएल तक हमें टारगेट रखना है. एंड अगर पेशेंट को 40 से ज्यादा रखने के लिए बहुत ज्यादा कोई एविडेंस नहीं है. सो एटलीस्ट 20 for normal people and 30 for people who have bone related issues. That's what is recommended by this guideline. I think this is a very fair statement. Maximum levels in many labs normal would be say 20 to 70 or 30 to 70 nanograms per ml. But जो ज्यादा vitamin D जब हम especially injections देते हैं और अगर किसी ने बहुत गलती से frequently injections दे दिए, that's when we talk of vitamin D toxicity. और उसमें vitamin D बढ़ जाता है, but that's rare and that's difficult with oral preparations and it's not so much of a problem. Talking about the last D, and then we'll take up the questions. What is the seventh D? It is all about direction. So, what is the message that we're leading to? Which direction are we moving on with respect to vitamin D, both from a healthcare professional perspective or from public perspective? And I think the important message from a healthcare professional level, I think many of us do know क्या vitamin D level होना चाहिए, क्या low है, किसको देना है. We all are also many times very well aware of the loading doses, but I think maintenance dose की कितने दिन के लिए देना है and long term per day कितनी requirement है वो काफी मिस हो जाता है. Unfortunately, India में follow up of patients is not that great. So when we start vitamin D, patients feels good, doctor feels good, 3 महीना 6 महीना हो गया, उसके बाद patient भूल गया vitamin D लेना, उसने सोचा कि कोर्स था खत्म हो गया. And then 1 साल बाद जब दोबारा प्रॉब्लम हुई तब चेक कराया तब फिर से very low. So this is something that we really need to avoid from a healthcare professional perspective. We need to make sure that our patient gets the daily recommended dose long term. क्योंकि अगर पहले patient का lifestyle ऐसा था कि the patient is not really got a good vitamin D, I don't think so. The lifestyle will change. जो हमारे IT professionals हैं, for us as doctors or anybody who's working within a air conditioned under the roof environment and not exposed to adequate sunlight, they are not going to get the adequate amount of vitamin D by any source अगर पहले नहीं था. And for even people, and for some of the studies that we've done in rural Indian women who are actually farmers, and despite them being in the sunlight for a very long time, they also don't have adequate amount of vitamin D. And part of this is attributed to our skin pigmentation and color. कि जितना भी UV rays आता है sunlight से, our absorption of that is not that great. So it's not that sunlight हो गया तो the answer is done. It's important to reinforce the overall importance of this therapy and persistence of therapy. And that's the one important message I leave for physicians. From a public standpoint, I think it's important to know about vitamin D, that it is an important vitamin. It is important to know that, again, किसमें अवेलेबिलिटी कहाँ रहता है, कितनी डोजेज चाहिए और क्या क्या फॉर्मुलेशंस अवेलेबल है. And I think the trend of fortified foods is increasing. So when we are going to a supermarket and we have something which is vitamin D, I think Delhi mein Mother Dairy has started fortification of vitamin D on a small scale. Not yet so much in Tamil Nadu, but I'm sure in other states as well. This is going to be something that's driven nationally over the coming years, and we have to see vitamin D fortification as in Western countries also. When it is implemented in India, we choose the right kind of food. So, friends, in this very small presentation of the 7 Ds of vitamin D, starting from demand, कितना हमको vitamin D का problem है, what is the problem statement of vitamin D in our country, talking about dosage, कितना vitamin D हमको देना है, कितने टाइम के लिए देना है, that's duration, किस किस पेशेंट में हमको more carefully देखना है, क्या क्या different delivery options हैं, what is our target level or the desirable level that we need, and what is the future direction. So friends, I will stop here, but we'd be happy to take questions.
Thank you, Dr. Nitin. You will be happy to take questions, and the list of questions is so long, I cannot remember a time in KK Med Talks when we had so many questions. So just be prepared for a long, long list of questions, and thanks to everybody for logging in. Let's go one by one, and we'll take all the questions as they come. So, Dr. Harsh Gupta says, you've spoken about vitamin D. What about side effects? Is there something known as hypervitaminosis D, and how can we recognize that?
Right. So as I mentioned very briefly, so hypervitaminosis D in Vellore, I would have seen say about 10 patients in the last 5 years. जिनका vitamin D 100 से ज़्यादा था, 100 nanogram per ml. So it's not very common, but जब हो, it can be quite difficult to manage. The main problem is कि जब हम इंजेक्शन को यूज करते हैं vitamin D के लिए, और वो भी बहुत ज़्यादा डोजेस में, अगर हम इंजेक्शन vitamin D दे रहे हैं, we'd like to give it for a year. Once in a year or something like that, जिनमें absorption problem है. But if we stick to our oral preparations, which are fairly, low dosed and well absorbed, I don't think we have to worry so much about the side effects. Injection may, we have to be careful.
And especially if the dose is, like 6 lakh units of injectable vitamin D once a week, sometimes we see those prescriptions. तब दिक्कत आती है. And even if you want to, let us say, I am prescribing injection vitamin D in a misguided attempt to get swift redressal. The modern gel capsules that we get, so like 60,000 units in gel capsule mixed with soybean oil, is the absorption swift enough?
Absolutely. I think that is one very good, mode of delivery that I would say, and many patients are happy to take that as a capsule.
So it's about being swift and then also playing it safe and smart. And our girls are fighting the Irish team right now in the T20 World Cup, and they're doing very well. 104 for 1 is India's score, and Samriti Mandhana is at 61 not out, and then Harmanpreet Kaur is with her on the crease. So it's about playing swift. They have to get lots and lots of runs today to win. They have to win by a big margin. But then it's also about playing safe, not getting out, not causing hypervitaminosis D, or not losing your wickets. More and more questions. Harsh Gupta says, and Dr. Vipin Mandula asks, what about correlation of vitamin D and diabetes or heart disease? Recently, we learned that there is around 3.5 to 4% reduction in risk of diabetes if vitamin D is given regularly.
Right. So vitamin D is linked to a lot of diseases overall. There's role coming up not only in diabetes but heart disease, in terms of dementia. But overall, whatever basic studies have shown, yes, vitamin D has some role to play in reducing the insulin resistance. So there is some role there. Can I rampantly use vitamin D only for prevention of diabetes? Probably not. I could definitely give vitamin D for the several benefits that I already described. And not only thinking of ki bas diabetes bachane ke liye khana hai, it shouldn't go as that kind of a message, because then people might just take an overdose when it's not required. But yes, there is benefit that is shown in terms of reduction of insulin resistance.
Yeah. Let's repeat that the best way to prevent type 2 diabetes would be healthy lifestyle. And if you happen to be overweight or obese, just try to reduce your weight by even 5%. Even that will suffice. It'll bring down the risk of diabetes markedly. Dr. Harshi Dhingra is with us. Madam is a pathologist from Punjab. And Harshi ji, my in-laws happen to be Dhingras. So her question is, should we take vitamin D combined with vitamin K2? And the same question coming in from Asia Energy. Vitamin K, is it essential? How frequently do you see deficiency of vitamin K?
Right. So vitamin K, I would not say is as important as vitamin D. It is important, but I mean the deficiency part of it is not seen in so much normal individuals. Yes, it is important if you have chronic liver problems. If liver disease is there, then yes, vitamin K is something that is very relevant to you. Now, why these preparations of vitamin D and K are often talked about together is because both are fat soluble vitamins, and therefore there is some role that vitamin D also helps in the uh, carboxylation of vitamin K, and therefore improves its absorption. But overall, I'll say the problem of vitamin D, let's tackle it separately. Vitamin K is required in my clinical practice in very selected patients, especially those with liver disease.
Liver disease, or if somebody is on an anticoagulant, and that would be very rare, not in routine practice. Question coming in from a doctor side, from Dr. Syed Nishat, and also from a public side, from Rekha Bhattaraji. Age 60, 60 plus, postmenopausal, which is the single vitamin which would be most helpful in general health, in thyroid, in arthritis, in preventing fractures, in preventing falls, and preventing fractures?
Absolutely. The answer is very simple. It would be vitamin D. Without doubt, I can say, coupled with calcium intake, I would say that's the most important vitamin for this age.
Let's repeat the dose once again in general for everyone. So, postmenopausal, the NIN, Hyderabad National Institute of Nutrition, वो कहते हैं 1200 मिलीग्राम कैल्शियम, जो कि खाना काफ़ी मुश्किल है. It's not easy to get 1200 milligrams of calcium from diet. जितना मर्जी दूध पियो, even in Haryana, like 1 liter दूध हम पीते हैं तो भी it's a bit tough. And vitamin D will help you absorb the calcium. तो अगर आप vitamin D लेंगे, आपने जितना भी कैल्शियम खाया है या पिया है दूध में, वो एब्जॉर्ब हो जाएगा, वो हड्डियों तक पहुंचेगा. तो आप ऐसे सोचें कि विटामिन डी वो हमसफर है जो कैल्शियम को पेट से लेके, आंतड़ियों से लेके हड्डियों तक पहुंचाता है, वो सफर पूरा कराता है. So roughly how much of vitamin D? Could you repeat a general dose for everyone? Let's say we assume that we are starting with a fair amount of deficiency.
Right. So if you're starting with deficiency, then I would say that I would like to give, say, about 6,000 units per day. So agar, to make it even more simple, as we were talking about Sunday ke Sunday, so if there's a 60,000 preparation which is commonly available in the market, I would like to give it once a week for a period of 8 weeks, and thereafter once a month, and that's what's going to give me around 2,000 units per day. So 60,000 units once a week for a period of 6 to 8 weeks, followed by once a month.
And you may wish to take it for 3 months also. That once a week. And जो question था how long? Because it is a nutrition. तो जैसे हम खाना throughout life खाएंगे, तो ये चीज भी throughout life लेंगे. Dr. Vipin says, role of vitamin D in chronic kidney disease. Is the requirement more or is it less in kidney disease and in liver disease?
Right. So as I said, that in patients with liver disease and kidney disease, जो हम vitamin D लेते हैं, that needs to get converted to an active form, and this activation actually happens in the liver and the kidney. And in patients with kidney disease, sometimes we need to give active vitamin D. Rather, at the stage of kidney disease, we commonly describe 5 stages. We have different targets of vitamin D based on the PTH levels. तो अगर आप पूछ रहे कि रिक्वायरमेंट ज़्यादा है, I would say definitely उसको monitoring ज़्यादा ज़रूरी है. And उसमें कैल्शियम फॉस्फोरस के डायनामिक्स भी इक्वली इंपॉर्टेंट रहते हैं. And the use of active vitamin D is also important in such cases.
And एक तरफ क्वेश्चन था अजय कुमार जी का, द सिम्टम साइंस ऑफ विटामिन डी डेफिशिएंसी, वी टॉक्ड अबाउट दैट इन चिल्ड्रन एंड एडल्ट्स. दूसरी तरफ था डॉक्टर नहीदा तरन्नुम का विटामिन डी टॉक्सिकोसिस, सो वी स्पोक अबाउट दैट एज वेल. अब फिर क्वेश्चन आ रहा है रेखा जी का, विच इज अ वेरी सेंसिबल क्वेश्चन. शुड एवरीवन इन इंडिया गेट देयर विटामिन डी टेस्टेड, और इट्स ओनली इन स्पेसिफिक इंडिकेशंस दैट यू वुड एडवाइज?
Right. So the simple answer for that would be that vitamin D test is sometimes little expensive for a common man to do. So in my clinical practice, what I would do is, if my patient cannot afford a vitamin D test, I would just check a calcium. And agar serum calcium normal hai, I am absolutely safe to give the recommended daily allowance of vitamin D. Agar mujhe jo bhi 2000 units per day dena hai, so that is absolutely fine even without checking. Or even if my patient has symptoms, I'm happy to give the loading dose and maintenance dose as long as the calcium and also probably the creatinine is normal. ये दोनों normal है. I am not worried about hypercalcemia or vitamin D excess.
अगर सीरम कैल्शियम भी नहीं चेक हो सकता तो यू कैन जस्ट चेक यूरिन रूटीन फॉर कैल्शियम क्रिस्टल्स. तो ये पुराने वाले स्टाइल से यूरिन माइक्रोस्कोपी से चेक किया जाएगा, नॉट विद द डिपस्टिक. And this can be done in every primary health center, wherever a microscope is present and wherever you have a diploma lab technician. So if there are no calcium crystals in the urine, it means there is no excess of calcium. So you can give vitamin D. All vitamin D will do is it will improve the efficiency of calcium transport from the intestine to the bone, and then it will allow calcium to get incorporated in the bone, कि आपकी bone strong हो जाए. तो calcium crystals देख लें बस. That's the cheapest, most economical way. One question coming from Vishal ji, that is, if somebody has vitiligo, किसी को फुलवेरी है, तो विटामिन डी की रिक्वायरमेंट बढ़ जाती है क्या या कम हो जाती है?
Right. I would say कि it is important कि same ही रहती है. I wouldn't say कि बहुत ज़्यादा आपको vitamin D देना है अगर vitiligo है या कम देना है. Yes, absorption may get affected because of vitiligo, but overall in a general patient, I'm not so much depending on sunlight. जैसे मैंने example दिया कि even community studies where we've looked at women farmers, वो तो सनलाइट में ही रहते हैं पूरा दिन, उनका भी विटामिन डी डेफिशिएंट रहता है. तो आई थिंक विटिलिगो है तो ऑल द मोर यू कैन बी केयरफुल इन गिविंग विटामिन डी, मेकिंग श्योर दैट यू आर गिविंग इट, but at the same time ज़्यादा डोज नहीं देना है.
And you will find that people with vitiligo in general have a more heliophobic lifestyle. Helios मतलब sun, तो वो सूरज से छुप के रहते हैं ज्यादातर. Heliophobic, सूरज से छुप के रहेंगे. कपड़े ऐसे होते हैं कि they hide the skin, तो धूप लगती नहीं है डायरेक्ट बॉडी को. And Dr. Nitin, there was this story कि जो किंग था, he wanted to find a happy person. तो पंडित जी ने उनको बोला कि you wear the shirt of a happy man and then you yourself will become happy. तो ये स्टोरी फाइनली आगे कैसे चलती है? What's the shirt that a happy man wears?
I am not sure क्या आंसर आप एक्सपेक्ट करें, but overall, yeah, the happy man has to be healthy, and so the question is shirt कौन सी थी?
हाँ, तो so actually पूरे किंगडम में the soldiers they searched high and they searched low, and वो मगरब में गए और मशरिक में गए और उत्तर में गए और दक्षिण में गए, and they couldn't find a happy person. Finally they found someone whistling, बहुत happy सी whistle थी, और फिर जाके देखा तो वो एक farmer ही था who did not have a shirt. He wasn't wearing a shirt. So that was so he gets vitamin D if you're not wearing a shirt, but वो आजकल possible नहीं है. But we'll continue with the questions. And Dr. Vipin says, sometimes patients say कि vitamin D या कैल्शियम खाने से किडनी स्टोन बनता है. तो किडनी स्टोन इंडिया में कैल्शियम के ज्यादा होते हैं या ऑक्सलेट के ज्यादा होते हैं? एंड हाउ डज कैल्शियम प्ले अ रोल इन रिड्यूसिंग ऑक्सलेट इन एक्चुअली रिड्यूसिंग किडनी स्टोन risk?
Absolutely. So I think this is a very important question. It's a very big myth. I mean, not only for vitamin D, but even for calcium. And काफी पेशेंट्स डर के मारे रहते हैं, ओहो विटामिन डी खा लिया, कैल्शियम खा लिया, अब किडनी स्टोन होने का चांस बढ़ गया. So as Dr. Kala rightly pointed out, the most common stone would be oxalate stones that are seen in our clinical practice. I think the most important reason of having these stones is that we don't drink adequate amount of water. Especially again, people who are staying in air conditioned rooms, उनको प्यास भी नहीं लगती है, and suddenly they go out, they sweat a lot, and they are back in the AC room, and their thirst mechanism is completely disrupted, and इतने बिजी रहते हैं कि पानी नहीं पीते. आई थिंक दैट इज द मोर इम्पोर्टेंट रीजन फॉर स्टोन्स रादर देन ब्लेमिंग इट टू पुअर विटामिन डी एंड कैल्शियम. कैल्शियम स्टोन्स जो होते हैं वो रेयर डिसऑर्डर जैसे हाइपर पैराथायरॉयडिज्म, जिसमें एक बीमारी है जिसमें हड्डी कमजोर होकर कैल्शियम बहुत ज्यादा पेशाब के रास्ते में निकलता है, एंड कैल्शियम स्टोन्स उसकी वजह से बनते हैं. आई थिंक दैट इज मोर इम्पोर्टेंट reason for stones when you talk of vitamin D. But our usual vitamin D would rather reduce the oxalate absorption and excretion, and overall would not contribute to development of these stones.
One question from Dr. Pradeep Raval. He says, I have a patient with Graves' disease, hyperthyroid, whose hands are shaking all the time. So, multiple questions. Should we give vitamin D or not? The answer is yes, because in Graves' disease, the bone loss is more. जो uncontrolled hyperthyroidism होगा, उसमें bone टूटती बहुत जल्दी है. So you should be supplementing with calcium and vitamin D, and of course safety के लिए serum calcium, urine calcium crystals. But जो hand shaking है, that is not directly because of vitamin D deficiency. For that, first of all, control the thyroid, and secondly, maybe a beta blocker, a safe beta blocker like bisoprolol is a modern one, and पुराना propranolol है जो वो भी हम यूज करते हैं in low doses. That will help your patient, but main treatment will be controlling the hyperthyroid. Two questions coming from Calcutta and Kolkata. Seema ji hain with the history of always asking very difficult questions. So you want to take, Dr. Nitin, you want to take the first one first or the second one first?
Anyhow.
Let's take the second one first. Malabsorption क्या होता है? So malabsorption, sometimes the calcium doesn't get absorbed. It can be because of worm infestation. It can be because of maybe diarrhea, because of pernicious anemia. So many things are there. But madam ka question hai, whatever the reason is, how do we ensure that the calcium is going to get absorbed? How do we ensure that the oral vitamin D will get absorbed?
Right. And I think medically, especially in big clinical studies that we do, the best way to find out whether our patient has got the calcium and vitamin D absorbed is through a simple test in the urine called the urine calcium. Ideally done as a 24-hour test, but even as a spot urine calcium creatinine ratio, उससे हमको मालूम हो जाता है कि ये पेशेंट में जितना कैल्शियम होना चाहिए उतना बॉडी में अब्सॉर्ब हो रहा है या नहीं. Because if the urine calcium creatinine is quite low, then I can safely increase the oral dose of calcium and vitamin D. So a simple way of finding out whether my patient's calcium is getting absorbed or not, or whether my patient needs more vitamin D, is to check the urine calcium. Another way of doing that again medically is through measuring PTH. Again, हमें पता है कि जैसे हमारा vitamin D कम होता है तो PTH level, blood में serum PTH starts to increase, and therefore in patients with CKD we actually target the PTH level to be normalized to supplement vitamin D.
PTH, parathyroid hormone, is a test that is difficult to do क्योंकि बहुत ही sensitive hormone है. तो you have to collect the sample under ice, then you have to transport it properly. ज़्यादातर field में ये नहीं हो पाता. Very rarely you will find that the commercial labs spend so much energy on this. So it would be safest that you keep vitamin D around 50, 60, 70 nanogram. एंड पीटीएच अगर आप रिसर्च सेटिंग में है मेडिकल कॉलेज में तो जरूर चेक करें, बट फॉर सेफ्टी अगेन वील रिपीट सीरम कैल्शियम, सीरम एल्कलाइन फॉस्फेटेस, एंड अ सिंपल यूरिन कैल्शियम, even calcium crystals, that will also suffice. The second question from Kolkata was, children are less exposed to sunlight today. That's true. So should vitamin D supplementation be advised for all neonates, all infants, all children?
So fortification is coming as a big way. I think there's a lot of work done in school children from the team in Delhi, Colonel Raman Marva and team. उन्होंने बहुत सारा papers दिए हैं कि मतलब आर्मी ऑफिसर्स में या जवान्स में या फिर इवन स्कूल चिल्ड्रन में मिल्क देने के बाद, जिसमें फोर्टिफाइड मिल्क वो देने से कितना इम्प्रूवमेंट होता है फॉर देयर विटामिन डी लेवल्स. एंड सो ओवरऑल यस, आई थिंक दिस इज द फ्यूचर. आपका क्वेश्चन बहुत ही jais hai, and a very important point it raises. And I think if we are doing a med talk 5 years or 10 years down the lane, we would be talking that yes, today all schools or midday programs which are there have fortified milk with vitamin D.
And Samriti Mandhana is now at 87 not out, and our girls are at 143 by 3, still 1.5 hours left for their batting. Dr. Vipin Bandula says Surya Namaskar, does it help? Yes, it does, but you need many hours. And there was this question also coming, how many hours of sunlight do we need? So actually the challenge is you need it maybe 11 a.m. to 2 p.m., that kind of time. It's difficult. Direct dhoop hoti hai. And you need the entire body to be exposed. You cannot say कि बच्चे ने school uniform पहनी है, trousers पहनी है, लंबी skirt पहनी है, या is wearing a salwar kameez and then doing a Surya Namaskar, then the sunlight won't enter. Also, we Indians are relatively more dark skinned, so the absorption of UV rays is less. And then pollution is another thing. ये भी studies हैं कि जितना ज़्यादा polluted atmosphere हो, and we lead the world in that as well, उतना ही ज़्यादा सूरज की किरणें, sunlight कम पहुंचती है हमारी skin तक. Seema ji asks if sun-dried mushrooms, which are a good source of vitamin D, are they sufficient for a vegetarian person, for a vegan person, from a vitamin D point of view?
I wouldn't say that they are sufficient. So there are certain things which are good, but how much is the quantum that you can actually consume that is a question which is definitely not going to provide you your 1,000 units per day. So I would say you may still need supplementation, but yeah, it's one of the natural ways of getting vitamin D.
There was a question on Strauss therapy. Strauss therapy actually means giving 6 lakh units injection once in 3 months. This question is from Dr. Shubhlata Chitwal, madam. So she says that the injections are not available nowadays. Ma'am, they are available in select places, but we prescribe very rarely now. Because what happens with this 6 lakh units, earlier we used to think that these will have very swift resolution of vitamin D deficiency. And that is true. It goes into the adipose tissue, and then you get a peak, but then you get hypervitaminosis. So it's not like you get a stable level of vitamin D, it'll go up and then come down. Now, we have better quality oral vitamin Ds. They are made in oil, like in soya bean oil. It's vegetarian preparation. And the absorption is such that you are able to get equally swift redressal. So instead of giving 6 lakh units stat, it would be better to give 60,000 units once a week for 3 months. In 10 weeks, you will get exactly the same dose and you might get a better response as well. Now, having said that, many of my patients who have been taking vitamin D injection for a long period of time, they like taking it. So they come every 3 or 6 months and they say, Doctor Sahab, taakat ka tika laga dein. So they get it and they go back and they are happy. Then we don't change. But for new patients, we don't advise anymore. Even for those with fracture, with fragility fracture, the oral vitamin D will be sufficient. Dr. Utsav Sahu, a very dynamic diabetologist from New Delhi. Lots of D's, D for dynamic, D for dude, and D for Delhi, the Bang Delhi. So he says vitamin D in metabolic disorders. And then a question that is added from Seema ji from Kolkata, mitogenic, metabolic, vitamin D and cancer, vitamin D and cancer prevention. So how does this vitamin occur at various, work at various receptors?
Right. So there's a lot of interest in vitamin D and research. And अगर आप देखेंगे कि कोई भी probably disease ऐसा नहीं है right from COVID-19 to cancer जिसमें vitamin D research नहीं हुई है. But I would say कि medically जो सबसे ज़्यादा proven benefits हैं वो bone related disorders में है. And I think that's big enough a reason for all of us to take vitamin D. So I think once we have such a big reason, we don't need to look for small reasons कि अच्छा इसमें इंसुलिन रेजिस्टेंस कम होगी, थोड़ी ग्लूकोज कम होगी या कैंसर प्रिवेंट होगा, तो उसके लिए लेना है. If it has benefits and there's still ongoing research on it, we look forward to get more robust data on it. But I think we already have a big enough reason to take vitamin D for our bone health, which is definitely proven.
So musculoskeletal, both skeletal and muscle, दोनों के लिए, even nerves के लिए, because it helps in improving neuropathy as well, vitamin D. और जो माइटोजेनिक की बात कर रहे थे, there's a disease called psoriasis, a skin disease. Psoriasis is also associated with vitamin D deficiency. In fact, COPD, chronic obstructive pulmonary disease, asthma, these are also associated with vitamin D deficiency. And when you supplement vitamin D, you are able to get better results. The soybean that is present in vitamin D capsules is minimal, so you can actually take it. For thyroid patients, why we tell them not to take soybean in breakfast, only at breakfast, is because soybean reduces the absorption of thyroid tablet. So the thyroid patients can take soybean at lunch or dinner. It's just that at breakfast, if they take it, the thyroid absorption goes down. Vitamin D directly will not be related to any eye problems. That is related more to vitamin A. This question was asked by Rajdeep Biswas ji, so thanks for that. And in men and women, जो पूनम बजाज का बहुत insightful question है. The value is the same for men and women. The normal is 30 to 100, but we should target something like 50 to 70 nanogram. Middle के बीच में रहे. Ideally, जो इसका आंसर है, we should be targeting a normal PTH, parathyroid hormone. But parathyroid hormone is expensive. It is inconvenient to do because you have to take the sample under eyes and then you have to transport it under eyes. So therefore, it's good to remain in the middle of the range. That would be the safest. Now, while the target is the same for men and women, in women at certain phases of life, the requirement can go up, and that would be pregnancy and lactation. खासकर जब प्री कंसेप्शन में कोई लेडी आपके पास आती है, कोई महिला आती है एंड शी इज प्लानिंग प्रेगनेंसी, कोई न्यूली वेड लेडी है, तो देन आई थिंक दैट वाज अ गुड विंडो ऑफ अपॉर्चुनिटी टू सप्लीमेंट विटामिन डी, क्योंकि पहले 3 months ऑफ प्रेगनेंसी में हम विटामिन डी देना अवॉइड करना चाहते हैं. यू कैन गिव इफ यू वांट, बट यू शुड अवॉइड अनलेस द पेशेंट इज वेरी symptomatic. And then I am reminded of this favorite Haryanvi song of mine, Dr. Nitin, and this is by one of our favorite singers. His name is Ajay Huda, and the song is Solid Body. So what he tells his newlywed wife is, it's a newlywed couple in the song, and he says, "महीने भीतर बन जाएगी तेरी solid body रे. Within a month, I'll make your body solid." And what is he going to give her? That is a separate matter. You have to listen to the song and watch the video to find out what he does. But from a Haryana perspective, that will be doodh and dahi and vitamin D. Ajay Kumarji says, if I take vitamin D capsules with peanut oil, will it help improve the absorption? Or peanut butter?
Yeah, so I think any kind of fat will anyhow absorb vitamin D, but I don't want to get into very high calorie rich fats because that is otherwise not good for you. So I would say ki in moderation. So simple things like milk can also give you adequate amount of fat soluble resource to take it.
सरताज जी का पॉइंट बहुत ही वैलिड है, एंड दैट इज के मंथ में एक दिन विटामिन डी जरूर चेक करना चाहिए. एक्चुअली सरताज जी, हमारा भी ये प्लान था कि हम इसको रेगुलरली डिस्कस करें. तो अगले महीने डेढ़ में एक तो विटामिन डी और एक रमजान, क्योंकि 1 महीने के बाद रोजे स्टार्ट हो जाएंगे, तो इन 2 चीजों पे हम फोकस करेंगे. एंड ये क्वेश्चन फिर से, अगर सोराइसिस हो या विटिलाइगो हो, तो यस विशाल जी, विटामिन डी सप्लीमेंट लाइफ लॉन्ग, वंस अ मंथ हमेशा के लिए. अगर सिम्टम्स हो तो वंस अ वीक भी ले सकते हैं. ओके, एंड देन दिस क्वेश्चन फ्रॉम न्यूट्रिशन, डॉक्टर नितिन, कुकिंग पल्सेस विदाउट सोकिंग and then cooking in pressure cooker. This is one of the reasons why oxalate gets deposited in the kidneys. So if you, Seema ji ka point valid hai that if you soak and wash the pulses, then the oxalate level comes down. Okay, Harshi Dhingra ka question. Dr. Nitin, your comments, and then let's see. Dr. Harshi is a pathologist from Punjab. There are 2 schools of thought for calcium. Okay. In America, they do not supplement calcium. So what is the difference between American diet, Indian diet, and why is that thought process there, that some people say do not give calcium?
Absolutely, I think a very very important question. तो अगर हम देखें डेटा, एंड आई मीन यू लुक एट एनी ऑफ आवर स्टडीज फ्रॉम वेलोर, हमने सब स्टडीज में जो एक डाइटरी रिकॉल किया है जिसमें 24 घंटे में हम कितना कैल्शियम लेते हैं ऑन एन एवरेज, आई वुड से रूरल person in Tamil Nadu would be around 300 to 400 milligrams per day, which is, I would say, pathetically low. अगर मैं अपना भी 24-hour dietary calcium लूँ, it would come not more than 500 to 600 milligrams per day, whereas the requirement of calcium for me would be anywhere between 800 to 1000. The requirement for any elderly who's a postmenopausal person is around 1200 milligrams per day. 1200 milligram मतलब हमें 1.2 liters of milk and milk product per day lena padega to get that calcium, which is definitely not going to happen. Now, this is in stark comparison to when we talk of data from US and the kind of diets that they consume in United States, जहाँ पे the amount of calcium in their diet is anywhere close to 800 to 900 milligrams per day. तो अब अगर उन लोगों को हम extra calcium दे रहे हैं in terms of tablets, I think there definitely it would uh, create problem, and that's why the data is conflicting. But from an Indian perspective, I think we are still very deficient, even in high calcium intake states like Punjab and Haryana. We don't meet the recommended dietary allowance of our calcium intake, and therefore recommendation in India should be different from the West, and we still need to consume more calcium than the West.
When we look at all India data, we actually find that calcium intake is really, really low across the country. And when you look at milk intake, Meghalaya has something like 50 ml per person per day. Haryana has something like 500 to 600 ml. That's the highest in the country. But that is also 500, 600 ml. And then there's a lot of diversity. It doesn't mean that everyone in Haryana is drinking 500 ml. There will be people at 0, and there are people at 3 liters also. So we need to supplement. There is another reason for this new school of thought. And from a pathology perspective, they say that calcium gets deposited in the arteries. And so if you eat more calcium, then you will get more of heart disease. So is that right? Or is this calcium deposition, this coronary calcium score that they speak about in cardiology, is that a normal part of aging? What happens, Dr. Nitin?
Absolutely, it's very much a normal part of aging, and often for medical students, when we do X-rays of foot, and we in diabetes, managing diabetes, do get a lot of patients with diabetic foot. उनका X-ray करने में क्या पता लगता है कि if the patient is old, and many times to medical students, I'll just show an X-ray and tell them कि आप age guess करो ये young individual का है या old individual का है, and when you see calcified vessels, you really know that this is old age. तो आई नो द वर्ड कैल्शियम साउंड सिमिलर जो हम कैक स्कोर या कार्डियक इवैल्यूएशन में बोलते हैं और इसमें करते हैं. आई थिंक देयर इज अ ह्यूज लॉट ऑफ डिफरेंस ऑफ व्हाट वी आर टॉकिंग अबाउट in terms of dietary calcium intake and the kind of calcium deposition which happens in arteries. It is different. That kind of calcium is actually dependent on a lot other parameters, mainly the cholesterol that you have, and the atherosclerosis that happens with aging, and the age related stiffness of blood vessels, and that's not what your dietary calcium is all about.
So it's not related to dietary calcium. In fact, the discussion is it related to dietary cholesterol also? That's also a plus minus. So many ifs and buts with that. But our Indian team has finished their innings at 155 for 6, comfortable score. And now let's see how our bowlers do. And today we have more than 4,000 registrations, Dr. Nitin. Post-COVID, this is one of our record numbers. So thanks to everybody for logging in. And Pooja ji and Anup ji कहते हैं no shirt. So they pointed out the happy man has no shirt. But you can be happy even with a shirt, and as long as you take your vitamin D. And Dr. Nitin, but if you're happy and you know it, what do you do?
Clap your hands.
Clap your hands. All of us can clap your hands and maybe stomp your feet, because it's now 70 minutes. And a few more questions. So Dr. Neha says, sir, could you repeat? Let us say you picked up hypervitaminosis D. Then what do? Of course, you stop the therapy. Then you can recheck after a month and a half. Anything immediate that has to be done?
I just check the calcium, and if the calcium is normal, I reassure. And as you said, rightly stop. If the calcium is not high, we don't worry. This will go over with time. ठीक हो जाएगा.
It goes away, but supposing patient has got headache, lassitude, not doing well, a simple treatment would be maybe half a tablet of furosemide for a few days. So in the periphery, you can do that. What furosemide will do is it will help excretion of Lasix through the kidney, high fluid intake, and then you can check after a few days. But don't worry too much about it. It is usually not going to be life-threatening. And the only reason why in the first place you will get vitamin D toxicity is if you've given injection vitamin D 6 lakh units once a week for 6 weeks. Let us take the opportunity to repeat a safe and smart dose for the vast majority of our adult countrymen and women. That would be 60,000 units once a week for up to 3 months. And then you can follow that up with maybe once a fortnight for a few months, and then once a month lifelong. If you're checking vitamin D, if your patient wants to get it checked, aim for something like 50 to 70, something in the middle, 50 to 70 nanograms. This is the middle of normal range. And we can assume that that will give you a normal PTH. PTH, I would strongly suggest that you check it only if you are sure that your lab is going to collect the sample and transport the sample and then analyze the sample correctly. If you're not sure, it doesn't make sense to waste money on that test. Unless, of course, you are suspecting primary hyperpara, then that is a separate matter. Uh, this question you'd already answered. Dr. Anindya had asked, vitamin D, you've seen toxicity just about 10 times in the past 5 years. And another question is, can vitamin D be given along with other weekly medicines on the same day, like maybe methotrexate or maybe risedronate? This question is from Dr. Anindya Devnath.
Yes, I would say it's okay to give, and probably if it makes the patient remember कि मतलब हफ्ते में जो एक बार दवाइयाँ खानी है वो उसी दिन खा ली, so it's fair enough. I think you should be able to take it.
Dr. Nabha Krishan Gohan's question about the time of the day for UV ray exposure, that was 11 a.m. to 2 p.m. or 11 a.m. to 3 p.m. STOS, like we said, we have used in the past. I have used a lot. This is before Dr. Nitin's time, but now we avoid it because we are aware of the side effects. A challenging question from Dr. Kamal. Many companies claim that their vitamin D products are aqueous soluble, water soluble. Can vitamin D be water soluble?
It's definitely a fat soluble vitamin, but with the pharmacokinetics, and we do have syrup preparations of vitamin D, which can be taken and which are equally good in their absorption.
And they can be taken anytime. And then Dr. Richa says, sir, what is the minimum value of vitamin D that you have come across? And what is the maximum that you have come across?
Undetectable to more than 100. I've seen everything.
Same here. Undetectable. And where I practice, initially I used to get vitamin D done more frequently. So when I came from AIMS to Haryana to practice, and my at that time my catchment area was Western UP and Haryana. Uh, there was so much of vitamin D deficiency, so much of severe vitamin D deficiency. And actually, the way the patient walks into your clinic and then you ask those few questions about being able to go to the Gurdwara or mosque or temple, that itself helps you diagnose. So, by looking at the patient, by looking at the surname of the patient, by looking at the way at the clothes that the patient is wearing, you can actually figure out. Now, I hardly ever get it done in my practice, honestly. So undetectable is the lowest for me, and highest would be around 150 that I've seen asymptomatic. See, it gets deposited in the adipose tissue. So even if you've given that injection, even if it'll get washed out, it'll get released from the adipose tissue over the coming weeks. So you don't need to worry too much. Dr. Mudassir says, can we give weekly dose to children, or would once a month suffice?
So in children also, I think the recommended dose for children, I think there was a question for 7-year-old, another question for 10-year-old. So it's around 600 to 700 units per day. So again, it can be given weekly to begin with and then monthly as a maintenance dose.
The easy questions, Dr. Nitin, let me take. So the question was from Dr. Vipin Parekh. Can I prophylactically give 60,000 units once a week for 3 months? The answer is yes. And Dr. Vipin also watching the Indian girls playing cricket. So thanks. And now the difficult questions for Dr. Nitin. So Dr. Richa says, Dr. Richa is a specialist in PMR, in physical medical rehabilitation. Child with Genu Varum. So that is a bone deformity. What investigations would you do apart from vitamin D? And her specific question is it indicated? Should I do calcium, phosphorus, alkaline phosphatase? Should I do any urine tests? And when is parathormone indicated?
Right. So I think very important clinical scenario, and very right, ये सारे टेस्ट करने जरूरी हैं because it's not only the calcium metabolism but even the phosphate metabolism which is important in terms of bone disease, and phosphate disorders can also present with these kind of bone deformities of genu varum and valgum. In addition to the test which I mentioned, I think a basic test of creatinine or renal function is important in this case. And apart from alkaline phosphatase, if facilities are available, we also check bone turnover markers. Yes, vitamin D is important. PTH would be important, especially if the calcium is high or if the creatinine is high, then PTH would be important. But all these tests are important. Another important investigation would be doing a good skeletal survey to try and find out what kind of bones are involved and what is the appearance, which can give you a good clue. And last test that I'd also do is to do serum electrolytes and bicarbonate. Again, renal tubular dysfunction can also present with a similar feature of bowing with acidosis in the blood.
So this question that Dr. Richa asked is really important. Let's spend a few minutes extra on this, even though it is 8:15 p.m. now. So the first reason for investigating is to find the reason. Most children will have nutritional rickets, but not everyone. So one approach is depends upon how resource limited we are. One approach is you treat everyone for nutritional rickets for 3 months and then reassess. Another approach is that the patient has already got treated from outside and is not doing well. Then the chances of nutritional rickets go down. See, had it been nutritional, the previous doctor would have been able to fix up. So then, Dr. Nitin, one, two, three, you've mentioned renal disease, you've mentioned renal tubular acidosis, and let's add hepatic disease also, and then gastrointestinal. See the three organs that are involved in calcium homeostasis: the GIT, the liver, and the kidney. That's three. And the gland that is involved, that is the parathyroid gland. So that is, these dangerous four. So what are the common differential diagnosis of nutritional rickets?
The most common differential diagnosis for nutritional rickets would be deficiency of vitamin D, which is again, because of poor intake or not being able to expose ourselves to adequate sunlight and nutrition. So that is still the most common cause. Iske alawa, the other causes are rare, but then there could be genetic causes, there could be phosphate related causes, there could be kidney related causes, which would come in this order. So again, I would say that every patient, it is individualized based on family history, age of presentation, the severity of biochemical abnormalities, and for that patient, then we would go further investigations in that line.
So one reason for getting the test done is to do a differential diagnosis. The second reason is to find the severity so that you know where you have started off, what the threshold is, and then you can target. After 3 months, you can test again to see whether the PTH has come down or not. And of course, one of the specialties that is most important in handling these children is PMR, physical medical rehabilitation, because if you take the child early enough, you will be able to optimize long-term outcomes. So a multidisciplinary approach is required. The other difficult question again comes from Bombay, from Dr. Vipin Parekh, who says, "Sir, what are the chances of developing renal calculus on 1200 milligram per day of calcium?"
So I would say if the overall nutrition of dietary calcium intake is not great, which is often the case, then giving 1200 milligrams of calcium is the RDA, and there should not be an increased risk of renal calculi in that patient.
Actually, the stones will be because of reduced fluid intake or because of increased oxalate intake. So the oxalate will come from spinach. So saag, palak, methi, bathua, from that is where the maximum oxalate comes from. Even chapati, wheat has got a lot of oxalate in it. More questions coming up, and this is from Dr. Samir, and he says, "Oh, Samir is 42 years young." So he says, "As an average 40-year young doctor, and we tend to have a very love-hate kind of relationship with the sun. So you go into your OPD or your operation theater, especially for anesthetist surgeons, you go in before the sun rises, and you come out after the sun sets. So what would be a pragmatic vitamin D dosage to take lifelong?"
I think the answer was same as was mentioned. शुरू में तो definitely कम रहेगा, तो we start with 60,000 units once a week. And as Dr. Kalra said, ki gradually after maybe 8 to 12 weeks, we can take it for fortnightly for the next few weeks, and then once a month lifelong.
And whenever you feel that your knees are giving way, this is at not at 42, maybe at 52. So you find difficulty in climbing stairs, or you think that your efficiency in the gym has gone down, then maybe it's time to get vitamin D. And if you do not recover, there's no harm in getting yourself tested as well. So calcium, phosphorus, alkaline phosphatase, and a vitamin D. These would be the basic tests, and then a urine routine also for calcium. One more question from Dr. Nava Krishan Gohan, that is vitamin D and depression. So you spoke of musculoskeletal effects, mitogenic effects, metabolic effects. What about mental effects of vitamin D?
Again, a lot of literature emerging in this area, not only mental, but memory, Alzheimer's, a lot of research happening. Vitamin D is effective in that. But overall, if you ask me, for my clinical practice, patients do have that feel good feeling after taking vitamin D, and that is helpful. Obviously, even if there is clinical depression in a patient, उसको साथ में अगर muscle pain है, and if you can improve that by giving vitamin D, they will definitely get that feeling better component because of relief from that muscle pain. So yes, there is literature on how it is helpful in depression. I think more randomized control trials will answer this better, but still we already have a big indication to treat, as I would say, for the muscle and the bone health. So we have to still treat.
Dr. Nitin, there is something that you have coined, the Moan syndrome. So, MOAN. Would you like to speak about that in Hindi and in English? जब किसी को दर्दें होती हैं, moan, that is moans, तो मरीज कैसे present करता है? And what would be the simplest, preventive therapy, nutritional optimization to prevent Moan syndrome?
Right. So I would say this was an interesting paper that we co-authored along with, I think, Dr. Vijay Kumar from All India Institute of Medical Sciences sometime last year. तो मोन जो हमें मालूम है is the term which is used as a pain का जो expression रहता है for any individual. So the idea of this syndrome called the Moon syndrome was to try and link the different aspects of musculoskeletal health. So मोन में M stands for muscle, O stands for osteo matlab bone, A stands for joint, and N stands for neuropathic. So I would say this is the most comprehensive term which links all the four symptoms of muscle, osteo, arthro, and neuropathic syndrome. And so if my patient presents to me with just muscle problem, so it is my responsibility as a doctor to also evaluate the bones, the the joints as well as the nerves, or vice versa. So that, in short, was the Moon syndrome.
Two more questions, Daksab, if you allow, we can take. तो जैसे Moon syndrome की बात हुई, so that segues into Dr. Seema's comment, which says that vitamin D and calcium both should be given, not only for muscle and bone health, but also for joint health, for osteoarthritis. Glucosamine is a plus minus. People do use it, but the evidence is not very strong. If it's help you, you can continue, but it may not help. जो देसी हरियाणा का टोटका है, that is haldi वाला दूध. So we advise haldi or curcumin to all our patients with joint aches. Actually, it has an anti-inflammatory effect. And last question from Dr. Swatantra. And you must have noticed by now, Dr. Kapoor, all the difficult questions come to you, the easy ones I take. Is vitamin D deficiency genetic as well? We are speaking of environmental factors all the time, but can it be a genetic disease?
Absolutely, it can be, though it's extremely rare. The extremely rare forms of vitamin D receptor disorders. I would say I have seen a handful of disorders in my last 15 years of endocrinology. But yes, there could be several other ways in which genetics can be involved with vitamin D, right from its synthesis to absorption to delivery. But I would say genetic causes are rare, and it's more still an environmental problem in our current day practice.
So it is environmental, but of course research चलती जा रही है, and every day actually we learn new things in medicine. तो यही तो beauty है medicine की, तभी हम grow करते हैं. जो पुरानी traditional wisdom है, उसके बलबूते पे हम आगे चल रहे हैं. So we are standing on the shoulders of giants. वो giants 5000 साल पहले भी थे, 2000 साल पहले भी, 100 साल पहले भी. उनके shoulders पे, उनके कंधों पे चढ़ के हम और ऊपर ऊंचाइयों की तरफ जाते हैं. वो सूर्य नमस्कार करते हैं. We try to reach for the skies, but we should remain grounded. एंड जब आप दवा दारू करते हैं, वेदर यू आर डूइंग इट फॉर मस्कुलोस्केलेटल, मेटाबॉलिक, मियास्मेटिक डिजीजेस, व्हाटएवर यू आर ट्राइंग टू ट्रीट, वो ट्रीटमेंट तभी संभव होगा, तभी इफेक्टिव होगा इफ वी हैव गॉट न्यूट्रिशनल ऑप्टिमाइजेशन. And today we were talking about nutritional optimization from a vitamin D window, a vitamin D perspective. Asia Energy says energy khoob aa rahi hai from Dr. Nitin Kapoor, and next time speak about magnesium. So that is a very good idea. Give us a month or two, Asia Energy, and we'll come back to you with a KKMet talk on magnesium, and it will be fun actually. And thanks to Dr. Yogesh, Poonam ji, Ali Nazakat Saab for being with us. Thanks Harshi for joining us. It's good to see. And Sartaj ji, आपके कान बहुत सुंदर हैं, बहुत स्वीट हैं, इसलिए आपको हमारी आवाज सुंदर लगती है. So thanks Sartaj for being with us. Okay, one last question. Aruna ji, please allow us to take after 2 weeks. The question is about milk. Will you be able to answer in 60 seconds, Dr. Nitin? The question from Aruna madam is, with so much against milk, that's one part of the question, do you still suggest milk?
Right. A lot of patients come against milk, but I think there is still a very important role of milk in our diet. And milk, curd, it's not only milk alone, it's curd, buttermilk, paneer, all milk products put together that we still can have. And I think India being a predominantly vegetarian or lacto-vegetarian country, I think it still plays a very, very important role. And there's still authentic milk. At least I'm from a small place in Vellore, and I don't have many problems with milk-related, industry-related comments that we hear from metropolitan cities.
So Anshu Singh ji कहती हैं, which is better, milk or curd? This is one of my favorite questions in the OPD actually. From 100 ml of milk, how much curd do you make? So I really enjoy teasing my children, my patients, and then I make sure they get into the kitchen, both the boys and girls, and they help their mummy. So it's the same from a nutrition point of view. मगर कई लोगों को lactose intolerance होता है. They are intolerant to lactose, which is the sugar that is present in milk. मजेदार बात यह है कि when you convert the milk into curd, फर्मेंट करते हो उसको, उसमें बैक्टीरिया आ जाते हैं, प्रोबायोटिक्स आते हैं. सो मेनी पीपल विद लैक्टोज इंटॉलरेंस आर एक्चुअली एबल टू टॉलरेट कर्ड इवन दो दे आर नॉट एबल टू ड्रिंक मिल्क. हमने अपनी ओपीडी में देखा है, व्हेन यू पेशेंट विल से जी दूध से ये दिक्कत आती है, वो दिक्कत आती है, तो व्हाई डोंट यू ट्राई दिस? 2 पत्ते तुलसी के या 2 पत्ते पुदीने के या 2 पत्ते ब्रह्मी के, व्हाटएवर यू हैव अवेलेबल, वो डाल के देखें अपने दूध में जब आप जाग बनाते हैं रात को, and take that curd the next day, and you will find that you will be able to tolerate. And of course it depends upon age. As you age, the lactase enzyme goes down, तो जितनी ज्यादा एज होगी उतना ही ज्यादा दूध हजम करना मुश्किल है. It's also about use and disuse. If you've never had milk for the past 20 years, so then don't start with 1 liter a day. Otherwise, pakka gadbad hogi. But if you have been drinking milk regularly, then your lactase enzymes will be working, so it's about that as well. But it's been great, Dr. Nitin, having you with us. आज हमने बात की vitamin D clinical update पे, and so many questions, so many comments. We'd like to thank everyone. Let me just repeat कि for almost all of us, of course, unless कोई बहुत specific situation है, 60,000 units once a week for up to 12 weeks, and then you can maintain every month. Some people may even wish to take every fortnight, and try to aim for maybe 40 to 60, 50 nanogram per ml, somewhere in the middle. Ideally PTH होना चाहिए, but that is not possible to do in practice. And Dr. Nitin, it's now 90 minutes. तो इससे ज्यादा जाएंगे तो हाइपर विटामिनोसिस हो जाएगा, because 100 से ऊपर, 100 नैनोग्राम से ऊपर we should not go. So let's remain within normal range. Last comments from your side, Professor Kapoor. Entire
Thank
India
you
is
so much,
watching.
sir. It was, I think, a great session. Thank you for all the audience. Itne interactive and itne sare questions. And as usual, it's my privilege to be with Dr. Kalra. It's always so much of learning for me, myself, learning from sir. So it was great. And thank you all for joining.
And another happy note is that Ireland is 14 for 2 in 3 overs.
No.
So sometimes lower is better. That means the Irish betting score जितना lower हो उतना अच्छा है. We continue to have more than 4,000 people logged in. So thanks everybody for logging in with us. And आप सबसे इजाजत लेते हैं. KK टॉक्स रोज होता है आपकी सेवा में. मैं आपको मिलता हूँ हर सोमवार और वीरवार. मगर इस जुमेरात एक गूगली होगी, तो I will be the guest this time. And Dr. Ali Jan is with us. Thanks, Dr. Ali Jan. So इस जुमेरात मैं गेस्ट होऊंगा और हमारे होस्ट होंगे डॉक्टर सुनीत वर्मा फ्रॉम पंचकुला. So he'll be hosting KK टॉक्स for today. इस सब के साथ आप सबसे इजाजत लेते हैं. शुक्रिया, धन्यवाद, मेहरबानी, शबा खैर एंड जय हिंद.